Hey everybody, it's Christinablackfeather here, and I'm doing kind of a response to Amberlynn's latest month behind upload about cellulitis. Well, about her ER doc visit, which was her second visit. She claims that the first one they didn't give her any answers at all, they just sent her back home. Um, so she went a second time and was prescribed antibiotics and didn't say what antibiotics. I can forgive that if it is something she can't pronounce. Um, but then was also she says she was given paperwork saying that she had cellulitis. Now, Amber said that there's no way it's cellulitis. She knows what that's like, and so she was going to plan to go to her regular doctor that following Monday or something. Of course, it's Amber's timeline, so we really have no clue. We're looking back into the past, like when you look in the night sky and you see the stars from, however many light years away they are. We're light years away on Amber's world. So I'm still going to address this because this is a very common issue, and I've had it a few times myself. The last time I had it actually landed me in the hospital, and I was working in a dialysis clinic where cellulitis is very, very common. Um, and because my own health wasn't the best at the time, I managed to catch it from a centipede bite. And not that centipedes carry this, but what happened is you have combine a weakened immune system. I was a lot heavier than I am now. So I was morbidly obese at the time, which is a risk factor, and worked in a place where, there's bacteria everywhere. Um, so yeah, it wasn't the best situation in the first place, and this ended up putting me in the hospital. Um, I had it on under my right armpit, and in 3 days the infection spread across both breasts. Had to deal with a breast surgeon because the question was going to be was I going to end up losing one of them? Seriously, this is how bad it was. I started spiking a fever that was almost 104. How I worked, I don't know, other than pure stubbornness. And by the third day, I don't know how I got home, um, because the fever and the infection was that bad. So, considering that she has clearly been diagnosed with cellulitis, it was a good thing she did go in. Um, Now, the thing with cellulitis is you do not have to have a lab test. You can look at it and see it for what it is. Oftentimes, they will go and take a sample of the pus that's involved, and there'll even be traces of it in any bleeding that is from the wound, and they will determine exactly what bacteria and what antibiotics are going to work. Very more often than not nowadays, considering that I think it's like about 75 or 80% of our population in the United States is carrying methicillin resistant Staphylococcus aureus, or MRSA. um, it's very easy that cellulitis is caused by that certain staph infection, which is extremely contagious, and that is the one that is going to get you sicker than a dog pretty fast. Um, she she probably waited a few too many days, but she wasn't really presenting any other symptoms other than pain. This would have gotten worse. So, that said, let's take a look first. And now she says that she's had this in the belly button. I'm warning you, there are some graphic images. So if you have a queasy stomach, look away from the computer and just listen to my voice or whatever. I'm sorry, but we're getting into the technical part. First things first, she has stated that she's had lymphedema and that she thought she had it in the belly as well as, she's denying it in the one leg. But we have certain stages of lymphedema. I'm not going to go into that, but you get the fluid accumulation subsides with elevation and pitting might occur. This is early signs in the lower legs. I've had the one video where you've seen the pitting in my own legs. It is very painful. There's a point though where the swelling doesn't reduce with elevation, and you can actually see through the skin what almost looks like little fibers, whatever, where you can it's this weird connective tissue thing that starts happening that you can see through the skin. And there's fat and fibrosis evident. So this is probably the stage that she might be at, is a stage 2. Stage 3 would be elephantiasis. Pitting can be absent. There's skin changes, fat fibrosis, and overgrowths. From what she's described, her stomach is not at an overgrowth yet. But some of these images you can see here, it's pretty bad. Once you get to this point, and there's different causes of lymphedema. It doesn't have to be obesity. I talked to one person that had commented on one of my YouTube videos a long time ago that she had it because of a mastectomy, and they had to remove lymph nodes. So your lymphatic system goes and pulls your extra fluid out of the interstitial tissues. It also helps filter any fluid that the circulatory system cannot remove from those interstitial spaces. It'll pull that out and then filter it back into your circulatory system, or bring it to your kidneys to be peed out, or bring it to your bowels to help increase fluid to help stool move out. So your body has a balance of how much fluid versus how much electrolytes, etc. So when you have a damage to the lymphatic system, a lot of this fluid will accumulate. And then in the legs, of course, I talked about venous stasis before, and damage to the veins, to the valves that prevent this fluid from being carried back to the heart and cycled throughout the body, and you get the pooling in the lower legs. So Amber, currently, the lymphatic damage is related to the obesity. It's harder for her body to remove this excess fluid. And so where she is getting some of the stuff, as you can see in this leg here and stuff, she's actually getting in her stomach by her own description. And all we can do at this point is just take her on her word for this. Boy, these images, I'm going to get demonetized, I swear. But, oh well. And then you end up where their skin breaks and there will be infection and damage occurring. So while people have commented on her video that she has not cleaned her belly button, and that's part of why she got the infection, which is partially true, if she already has lymphedema in her belly area, that is going to cause a weakened point to begin with. Because this fluid is pooling and it's not cycling through the body, bacteria like to go where there's this nice, lovely, moist environment that it can't be gotten rid of out of that area. So they just kind of multiply in that spot because, well, it's just perfect. Nice warm fluid. There's lots of nutrients, it makes them a happy thing. Now where to go? I lost it. Okay, so now we're going to look at a little bit more graphic images. This is what will happen with cellulitis around the belly button. And Again, you will see a lot of this with morbidly obese. And yeah, cleaning is a major part. You really want to keep that area clean. It can get gross. But you see, cellulitis and infected cellulitis is not pleasant to begin with. You'll see it a lot in babies with the umbilicus if it's not properly cared for. I don't know why Johns Hopkins has a picture of a cat, but we will look at the cat. It's a lovely cat. I don't know how that ended up with cellulitis, but Oh, cat scratching. Oh, yeah, well, that'll do it. But it's a lovely cat. So yeah, it's pretty nasty stuff. This is not something that you want to play around with. So at this point, she's saying that she'd gotten an actual infection. So it moved from lymphedema to be an infected lymphedema. And the belly button is an area that easily breaks open, or because you've got that nice warm hole, bacteria like to go sliding in there and just kind of hang out. And so that's more than likely what happened. And in her case, the first symptoms she noticed were bleeding. So she went into the doctor, got the antibiotics. Now the symptoms of cellulitis: red area of the skin that tends to expand. We don't know how big this had gotten. She did say it was spreading. You get swelling, tenderness, and pain. Okay. I don't think she would have realized that the area was that much warmer. It depends on how cool her belly skin was to begin with. It's since she's almost 600 pounds or probably over that, that is something that she might not be able to feel any of that. Eventually, she would have gotten to fever. There would have been red spots that she can't see. There may be blistering. There may be skin dimpling. She hadn't gotten to the fever as far as we know. So that actually was good, because that said her body's fighting it off to an extent where it has not gotten systemic. So she got to the doctor in time before that could get systemic. So you're supposed to seek emergency care if you have red, swollen, tender rash, or a rash that's changing rapidly, or you've had a fever. And again, it gets into the causes of cellulitis here. So we have injury. Any cut, fracture, burn, or scrape gives bacteria an entry point. And so again, that belly button can be a very nice entry point if there's any microabrasion of any kind, which when you have lymphedema and everything's swelling that much, the skin is going to split, and that's going to cause that entry point. Weakened immune system. When you have metabolic syndrome, your immune system is a bit weaker in the first place. Very clearly at her weight, she has metabolic syndrome. Well, has the symptoms of it. I can't diagnose it, but it's there. I mean, yeah, I'm sure her thyroid's not working. Her pancreas is overworking if she still is able to produce insulin at this point. Skin conditions. Now, this is where I'm at risk because of the severe eczema in my hands. Athlete foot and shingles can cause breaks in the skin, which give bacteria an entry point. Chronic swelling. That's, again, lymphedema. Sometimes can happen after surgery, which is not her problem. History of cellulitis. Now she has a history of cellulitis, even though she's in denial of it. And Amber, if you're watching this, you have a history of cellulitis at this point. Do not ever tell another doctor, if you get this again, that you've never had cellulitis and that you know that that's not what it is, because, girl, he diagnosed it, you got it, or you had it at this point. And obesity. It's a thing. And you were lucky you went in. You really, really were. The infection can spread to deep tissue layers, and it can start getting necrotic, where the tissue starts to rot. around this. The cells are dying, and it just kind of, then you get more and more of the pus, and that's where that pus is coming from. You're going to have a scar there. Sorry to say. And the cellulitis recurring, now the doctor stuck you on the antibiotics because this had a good chance of spreading. It was not going to resolve without the antibiotics, and I really, really hope that you took the full course of antibiotics and used the topical. I'm assuming he probably gave you muciprin, which is also known as Bactroban. And you can keep that tube handy and use it in the future because it's a very good antibiotic. It is for the stronger stuff that you may run into. So, if you've got bacitracin handy and that works, that's the one you want to use first. You don't want to go using the big one and then have those bacteria in the future become resistant to the Bactroban. Would not be good. So what they gave you is they gave you the protective cream, the Bactroban, and sometimes like things like Vaseline, Aquaphor, not straight lotion. You want a straight over-the-counter ointment to protect those areas. Cover the site with a bandage. If he put a bandage on your belly button, keep changing that dressing. And watch for further signs of infection. If you have this, you have to watch for streaks on your skin of redness that slowly start coming from the wound or from the infected site, and they start moving up your skin. This can be on your arms, this can be across your belly, whatever. That means the infection is spreading, and you need to get to the emergency room right away. People with diabetes and poor circulation need to take extra precautions as well. At this point, we know, Amber, that you have poor circulation. You've even stated this, but there's no way your circulation is being effective at your weight. So you need to have look between your toes every day. You might not be diabetic at this point, but you need to take care of your feet. And the reason why is because if you have any sort of sore in between your toes or the bottom of your foot or anything else, this cellulitis can recur and it can find a new open area to spread itself to, and that would be a great candidate. And when you have people who are obese or diabetics who get these infections between their toes, oftentimes what will happen is they start losing toes. They have to have them surgically removed. Then it moves to the foot. Then they have to have the foot surgically removed on the next infection. And then an amputation just below the knee on the next infection. And you see where this is going. This is not the state you want to be at. So even though I'm sure the cellulitis has resolved by this point, still make sure to do proper foot care, Amber, because you're at a really, really great risk. This is trimming your fingers and toenails, moisturizing your skin, protect your hands and feet. Don't walk around barefoot, and treat infections that you get right away. Athlete's foot, a little cat scratch, anything like that. Wash with soap and water. Any soap and water will do. And then treat it with, if you don't have bacitracin handy or a triple antibiotic ointment, you can use Vaseline right away, if it isn't a blazing open cut that needs stitches or something. If it's a scratch, you can use Vaseline or Aquaphor after you've washed it. That'll help protect it from bacteria getting in. So that's where we sit. And we'll end this video on a cute note. Here we go. We're going to have a happy note. There is a happy note. Let's blow this up. There. So, yep, there's your thing on cellulitis, and there's your thing on Mama Cat and Kitten. So, everybody have a great day. Blessed be.